So let me start today by looking at essentially the first learning outcome. Now, that's a bit of an overview of this particular unit, which is facilitating change in health and social care. There are a couple of things that we look at, when we talk about health and social care sector, or we talk about the National Health Service, mental health services, things like that, which are all within the remit of the health and social care sector. What we do tend to see is that there are a couple of things which are driving change in this particular sector. Now, one of the things that we look at when we generally consider health and social care, we include things like health services, mental health services. We look at services provided to look at care services which are provided to the elderly. We also look at services which are provided to young people or vulnerable adults, things like that, and they're all a part and parcel of this particular sector. Now, within this sector, we do see hospitals, GP surgeries, care homes, nursing homes, various governmental organizations. We see NGOs, we see social enterprises, all working within this context to provide services. Now, some of these services within the context of UK are predominantly provided by the National Health Service, and we have obviously an NHS Act, and we've also got a Healthcare Act, which was introduced in 2010, and the NHS Constitution, which was introduced sometime, I think, in 2009. Since the NHS was started after the post-World War II era, most of these services in the UK are provided, as a welfare state. Most of these services are provided free of cost to everyone who's resident in the UK or is a citizen of UK. Now, when we look at this, some of these services are directly provided by the government, some of these services are provided by social enterprises, NGOs, and some of these are contractual services which the government actually contracts out to third-party agencies, could be private sector companies, and they provide, they work in conjunction with the respective departments to be able to provide the relevant care required to be given out to patients, people within the sector. Now, in general, the idea of studying, change, the topic of change within this, qualification that we are looking at doing, which is, extended diploma in, health and social care, management of health and social care, is because of two things. One is two reasons that I can think of, why do we study this, is because as we have progressed from the industrialization phase to the globalization phase, what we are seeing is there are three constants which are currently happening, which are currently present. One is because of the mortality rates being reduced, because of the invention of new cures or medicines. What we are getting to see is that we are able to generally live longer. So the average lifespan in terms of people looking across the globe, different countries have different averages, but we look at, in general, the factor is that one of the key things is that our lifespan is generally increasing because of the availability of better care, medicine, and in some cases preventive care. This is allowing us to kind of live longer, and life expectancy in general is increasing. The second thing that we see, which is influencing this sector and as compared to some of the other sectors as well, is the rapid change in technology which is happening. So if you look at a couple of decades back, there were lots of things which were predominantly not available, not present. So the availability of, say, for example, new drugs, the availability of new, technology in terms of machines, things like an MRI scanner, things like, a CT scanner. These were things that were in terms of technology which have been introduced post 1970s. So what we do get to see is that there's a large influence of technology happening within this sector. Wellington, my suggestion to you would be if you pause your, mute yourself for now if you're not asking questions, so that there is no background noise. And what we do get to see, the third factor being that because the life expectancy is increasing, there's a large influence of technology happening within the sector. The third part that we see is that there is a large growth, or there's a continuous and a quantum growth happening in the population across the globe. So what is happening is, in addition to we living longer, there are more and more people which require these services. In the context of studying facilitating change is that this sector in particular is adapting, is needing to adapt to a lot of changes happening because they are affecting the provision and the provision of healthcare services within every country and within every geography. So what we do get to see is that change which is happening is transitioning to a certain extent the way these services are provided within this particular sector. And what we do get to see is that there is no one particular set, let's put it this way, a rule which will help provide these services to different sectors, different regions, and different types of population across the world. So there is, to a certain extent, what is happening is everyone everyone in terms, when I say people which require these services now, have diverse needs. And because of these diverse needs, what we need to be able to do is understand how the provision of health and social care can be facilitated to individuals more so in a personalized manner. So the whole idea of understanding this particular unit, in terms of, as the name gives itself, gives us a clue, is that when we try to look at provision of providing these services to different people in different countries, and we kind of dole out these services with the use of different types of technologies, what we need to be able to understand is how change is impacting the delivery of these services, to people, to patients, and to the individuals who are receiving care at the end of the day. So this particular unit has been divided into 3 learning outcomes broadly. The first learning outcome talks about identifying the factors which are driving this change. So some of the things that I've spoken about very briefly, I will cover this in slides now, and we will back this up with data which basically explains what are these factors and why this change is being driven by these factors strongly. The second part of the unit basically talks about how do we evaluate these changes happening, and what are the strategies which can be employed to ensure that the change which is being implemented is benefiting the patients, the people, or the individuals who are receiving these services. And then to a certain extent, we will also understand how the provision of health and social care services is done within the context of a particular country. So in our case, we will look at the National Health Services, or the NHS, and how this whole provision of health and social care is done within the NHS, and how these services are then provided to people and public within the UK. And the last bit is, so you understand the key factors which drive change, what are the strategies and how the change is implemented, and with these changes being implemented, how these services are provided. And towards the end, what we will look at is understanding some key frameworks. In particular, when we look at these key frameworks of change management, is what we will essentially study in the learning outcome 3, and there'll be a few models or frameworks that we will look at in particular, which will talk about how these changes are brought about and implemented, and why there is a standardized approach that we need to look at when we implement these changes. So I'm going to try and unmute to get some. So this is the essence of obviously looking at studying this particular unit. And today in this first session, what we are going to be doing is primarily concentrating on understanding the key factors which are essentially driving this change within this sector. Is that okay?
Yeah, that's fine.
Okay, good stuff. Now, just going through a few slides that are put together, and we will discuss as we go along some of these slides in a bit more detail. So let's understand, the first is, let's understand healthcare sector in particular. What is the complexity, and why is this particular sector slightly complex as compared to some of the other sectors when we look at telecommunication, technology, manufacturing, production, things like that. Now, what we do see is that there are lots of different policies which are a part and parcel of this particular sector. Now, globally, when we look at a lot of organizations like World Health Organization, UNESCO, some of these organizations also create policies which then require a coordinated effort by different countries and the provision of services within these different countries to have some sort of a coordinated effect in the case of say a global catastrophe. So when we look at the outbreak of Ebola virus, which happened last year, in the early months of the last year, what we did see is there was a concentrated effort which could be put in place because of global governance and some sort of policy and guidelines present in this. So one of the key complexities is that each country cannot, or each let's put it this way, each country cannot actually independently create a policy on health in particular, but they have to keep kind of dip in and dip out and borrow some of the practices, law and legislation with respect to some of the other countries that they work with when we look at healthcare services. So when we look at UK in general within the European Union, we have a provision of a European Health Insurance Card, EHIC card. So when we travel abroad, we are able to get access to various, medical services or healthcare services in particular as a tourist in different countries within the European Union, and that is possible because of, we are a part and parcel of the European Union, and that is covered under one particular governance or some sort of a coherent policy. Now, what we also see, one of the reasons is that there is a lot of ways through which this particular sector can be funded. Now, in general, when we look at some countries like UK, Australia, Canada, what we do get to see is that the healthcare provision in these countries is provided by the state. That means medical and healthcare services are absolutely free of cost. But in some countries, these services are charged, or the private sector steps in with public-private partnerships to be able to provide these services. So in some cases, the funding model for these services is also complex. So when we look at UK, the funding services are provided by the funding to this particular service is provided by the government, and I think it will be fair to say that 1/6 or 1/7 of our budget, when the Chancellor presents the budget, is actually aligned towards the NHS. So we have about, I think, 140, 150 million pounds is provisioned, towards the healthcare services, healthcare in general under the NHS every year, and that's about 1/6 or 1/7 of our income. Now, when we also look at, healthcare, one of the other complex reasons within the complexity of the sector is that we look at numerous number of issues which can be covered under this particular remit. So we look at, there are some slides which are put together. For example, when we look at, provision of services, we look at different types of services which are coming in. Now, under the NHS, we normally get to see healthcare, mental health care, and we look at, care services, clinical care services, which are, all falling within the remit of this particular sector. Clinton, are you able to hear me clearly? Hello?
It's not very clear. I think there's a lot of interference, I think.
Right, okay. Give me 1 second. Wellington, are you able to hear me? I think there's a bit of delay in terms of Wellington receiving. And 1 second.